Hi, I'm Mike Melia, the director of the Adult ID Fellowship Training Program here at Johns Hopkins. And on behalf of our faculty, our fellows, our staff, and our entire division, it's my privilege to be able to be with you now to share some information with you about our program. Over the next bit of time together, this is what we will cover. We'll talk initially about the mission of Johns Hopkins, and then move on to share some information about our program leadership, the clinical and research training available through our program, share some information about our current fellows as well as recent program graduates, and then talk a bit about living here in Baltimore. So quite simply, the mission of Johns Hopkins Medicine is to improve the health of the community and the world by setting the standard of excellence in medical education, research, and clinical care. And within our program, we build on that grounding mission by aiming to train fellows who will go on to become leaders within the field of infectious diseases. As you might imagine, it takes a village to accomplish this goal, and here's just a few of the faculty members who are helped to steward the program. Alongside me, I work with our Associate Program Director, Dr. Sonia Krishnan, who is engaged in both clinical and research activities here in the division, as well as a portfolio of educational work. We're joined by Drs. Sarah Cosgrove and Joel Blankson, who are the PI and the co-PI, as well as the chair and the co-chair of the T32 grant that helps to fund our training program, as well as our Fellowship Research Guidance Committee, respectively. Dr. Cosgrove is a leader in antimicrobial stewardship related research, and Dr. Blankson is a leader in HIV basic science pathogenesis, as well as investigations of elite control of HIV, as well as a range of now activities within SARS-CoV-2 virus infection. So building on that initial leadership structure, I thought I would spend some time talking with you about what the clinical program is like within our program, and would start with some initial comments about the clinical training generally, and then move on to talk about some of the individual services through which you will rotate within our program. I would say it's really a remarkably rich array of clinical educational experiences available within our division. We see a really remarkable array of different infections ranging from bread and butter to more complex and esoteric infections that one might see once or twice over the course of fellowship training, and then occasionally over the course of a remainder of a career. The patients that we serve are largely based here in Baltimore City, although we certainly see a range of patients from surrounding communities, surrounding counties outside of Baltimore City, the remainder of the state of Maryland, as well as the surrounding geographic area. And then, occasionally we certainly see patients who come here from other states across the country, or even other countries globally, to seek care for complex medical problems. One of the points that I want to make about our services is that on each of our core consultation services, we have a solo attending service that works in parallel to our teaching services. And I'll talk a little bit about each of the details of those services, but that's the mechanism that we employ within our division and across our the different consult services to help offload volumes from the teaching services and ensure that there is sufficient time for fellows to be able to really engage and immerse themselves in the care of their patients, as well as to make sure that we have protected time for teaching on rounds each day in the afternoon. So I'll talk a little bit more about each of the services now. And so you can see the first sub-bullet here on the slide is that fellows will expect to spend between 6 and 7 months on the general ID consultation services over the course of the first year of their fellowship training. That's split between the Mann service, named after John Mann, a former faculty member here, which is the general ID consultation service at the Johns Hopkins Hospital, as well as the Greenough service, named after Bucky Greenough, another esteemed former faculty member, who is that's the consultation service at the Johns Hopkins Bayview Medical Center. And both of those are general ID consultation services, although they are complementary to one another. So at the Johns Hopkins Hospital, we see a range of patients as it is a quaternary care hospital. So you have all of the specialties of medicine represented, general surgery, as well as all of the surgical subspecialties, neurology, psychiatry, obstetrics and gynecology, internal medicine, and so on. So we see patients in consultation from across those services on both the general wards as well as within intensive care units. And that provides over the course of the year a really robust and remarkable array of different patients. And then at the Bayview Hospital, it's a similar distribution of the different specialties of medicine with a little bit more of a couple of points of emphasis at Bayview. So at Bayview, there's on average a little bit more of a community feel, a greater proportion of bread and butter ID cases at Bayview as compared with the Johns Hopkins Hospital, but also some unique aspects of seeing patients at Bayview. For example, there's a burn unit at Bayview that we don't have at the Johns Hopkins Hospital, so fellows will get an opportunity to engage in care of patients with burns and complex infections associated with that problem. As well as the National Institute for Aging is based at Bayview, so a bit of a more of a geriatrics focus to some of the consults at Bayview, just as examples of the ways in which the two clinical experiences are complementary to one another. On all of our services, we have caps on the number of new patient consults the fellows do per day. Again, that's a way to ensure a couple of things. One is to make sure that fellows see enough patients every day and see a sufficient range of different infectious diagnoses over the course of their year of training, and then also to ensure that they're not seeing too many patients in a particular day that would detract from the educational and learning experience. So we, through combination of conversations with both fellows and faculty over the course of time, have landed on what I think and others feel in a consensus fashion is the right number of new patient consults for each of these services per day. So on the MAN service, which is the general ID consult service at the Johns Hopkins Hospital, that's a service that's staffed by one attending, 2 fellows, and then potentially additional learners, as well as a representative of our pharmacy team who rounds with the consultation service every day. And each of the 2 fellows on the MAN service does up to 3 new patient consults per day. Generally, that works out to be 3 per day, given the volume of patients we see on the service. So fellows take consults either until 11:30 in the morning, or until they each get 3 new consults per day. And then they're capped for the day, with the remainder of new consult requests going to the 2. There's actually now 2 attending only services for the MAN service. So those attending see the remainder of new consults for the day. And after each fellow has their 3 new consults for the day, they immerse themselves in the care and understanding of those patients and then round with the attending together on rounds, understanding that the consult service will not get new patient consultation requests during rounds, thereby providing protected time for teaching and learning, as I mentioned earlier. The Greenhouse service, which is based at the Bayview Medical Center, is 1 fellow and 1 attending, and in part because of the on average, more bread and butter feel to the cases at Bayview, the Bayview fellow takes up to 5 new consults per day, or until 11 o'clock in the morning, again, whichever of those 2 comes first. And there's a solo attending only service that sees subsequent new patient consult requests for the day, again providing time for protected teaching and learning for the fellow with the attending on rounds in the afternoon. The third main consult service for fellows during their clinical year is the second sub-bullet on this slide, which is the transplant oncology consultation service, or the Tucker service, named after Pamela Tucker, an esteemed former faculty member here at the institution. And that consult service is based at the Johns Hopkins Hospital. You can see fellows spend somewhere between 2 and 3 months on the Tucker service over the course of their first year. And that's a service staffed by a dedicated group of faculty that see only patients with transplant or oncology-related infectious complications. So those faculty only attend on that service and not on the general ID consult service. And it's really a very, it's an incredibly informative and educational experience taking care of patients with complex disease processes, complex infections, with truly national and world experts in these domains. And so the fellows have a remarkable educational experience taking care of patients on the Tucker service. That service also, again, has a parallel solo attending only service, and on the Tucker service, they cap at no more than 4 new patients per day, with the possibility of taking 1 new patient between 1 and 2 p.m., but no more than 1 new patient consult after 1 p.m. I'm not sure that the details of all of that are that important at this point, although very happy to talk with you about them on your interview day. My point is just to communicate that we do have caps on each of these services to help preserve the quality of the fellow educational experience over the course of their clinical year. So those are really the 3 main consult services through which the fellows rotate. They also spend somewhere between 2 and 4 weeks on our inpatient Polk service, named after Frank Polk, a former faculty member here, who helped to implement the first one of the first ever, HIV clinics in the United States. And that is a dedicated unit that primarily cares for patients with HIV infection, although there can be patients with other complex infections, such as patients who are transferred from other hospitals with endocarditis, for example, might be admitted to internal medicine on the Polk service. And so the fellows spend, again, between 2 and 4 weeks on the Polk service a year, where they serve really largely patient care and educational role. So the Polk service runs throughout the year with a team of ID faculty and internal medicine residents staffing the service, such that a fellow is not always present on the Polk service throughout the year, and as such can run without a fellow. So when a fellow joins Polk, they're present on rounds for the morning to hear about new patients and sort of serve as a junior attending, discussing their thoughts about patient management before the attending shares their thoughts and a plan is developed for the day. And then in the afternoon, the fellow really takes on a teaching role with the residents and any students on the service, teaching both about HIV and its related complications, as well as non-ID topics. It's a great opportunity for fellows to teach about antibiotics, for example, or other topics of interest within ID for the residents. So it's a little bit of a lighter rotation. The fellows are not primarily responsible for writing notes on the Polk service, and it's a great both patient care and teaching opportunity for the fellows. Over the course of the first year, each fellow spends a couple of weeks in our microbiology laboratory, meeting the faculty and the staff who work in the lab. It truly is a world-class microbiology laboratory with incredible resources available. It's on site here, and so it's great for the fellows. We do this relatively early in the year, in the September-October timeframe, to give the fellows the opportunity to meet and talk with the microbiology staff with whom they'll liaise over the course of the year and learn some of the fundamentals, some of the basics of microbiology that are important for ID fellows to understand. And then in the second half of the year, our fellows spend a couple of weeks engaged in outpatient subspecialty ID clinics. These range a broad array of topics, including diabetic foot infections, a tuberculosis clinic, immunodeficiency clinic, viral hepatitis clinic, transplant oncology ID clinic, and so on, a way of helping to ensure that fellows have the experience and educational experience in some of the more niche areas of infectious diseases that might not routinely be covered in the context of inpatient clinical practice or an outpatient general ID clinic, and also ensure that fellows have that outpatient experience working with a broad array of faculty within our division. And then finally, over the course of the clinical year, fellows will spend a half day per week in an outpatient general ID clinic based either at Green Spring Station, which is a little bit north of the Johns Hopkins Hospital, or at the Bayview Medical Center, which is our other site for general ID clinic training. And we look forward to talking with you about all of this in more detail during your interview day. In terms of clinical responsibilities during the research years, the second and potentially third years of fellowship training, The main component of that is the second-year longitudinal HIV clinic. So I just mentioned that fellows during their first year spend a week in general ID clinic throughout the year, a half day per week in general ID clinic over the course of the year. And during second year of fellowship training, each fellow spends a half day per week in our Bartlett Clinic, named after John Bartlett, former faculty member here, in the outpatient HIV clinic, providing longitudinal continuity primary care for a cohort of patients with HIV infection over the course of the year. That is staffed by faculty with a dedicated interest in providing outpatient HIV care, and each fellow has their own panel of patients that they'll follow longitudinally over the course of the year. Complementing that, as I'll mention in a few slides in a bit, we have a longitudinal HIV curriculum oriented and developed specifically for the fellows by Eileen Faculty, one of our faculty members here who also precepts an ID clinic. Eileen has put together a wonderful curriculum focused on sort of building foundational knowledge for the management of HIV infection for fellows, and she delivers that to all second-year fellows as well as all third-year fellows each Friday afternoon, as we'll talk about. So that's really the main aspect of clinical training for second-year fellows. And then during fellowship years 2 and 3, all fellows provide some weekend coverage of the inpatient services, which typically spans somewhere between 6 and 8 weekends over the course of the year, as well as between 6 and 8 weeks of jeopardy or backup coverage over the course of the year, which those are combined with weekends of antibiotic approval pager coverage, as you can see on the slide, and we look forward to talking with you about during your interview day. And then finally, there is an opportunity for fellows who have capacity and interest to engage in further education within some of our other outpatient clinics in the event that that is of interest. So a fellow, for example, who's engaging in clinically oriented tuberculosis research who wishes to spend more time in TB clinic may do so, and so on for the different clinics that we have at our institution. So I guess I would say just a few highlights in terms of the clinical experiences. As I mentioned, the way that we structure the services and the caps that we place on the number of new patient consults that each fellow can do per day really helps to prioritize a learner-centered approach to education and clinical experiences and your overall clinical training here. We have, as I mentioned, attending-only consultation services that offload clinical volumes on the fellow services, ensuring that fellows, again, have protected time for teaching and learning on a daily basis. I mentioned some of the opportunities for teaching while on service, for example, the teaching of residents on the Polk service, but on all of our services, and in particular our general ID consultation services, we frequently have residents and students rotating on the services, which is a great opportunity for fellows to engage in teaching of more junior learners who are interested in ID. And finally, given the size of our incredible faculty, we have more than 90 faculty within our Division of Infectious Diseases. There's frequent opportunity to liaise with nationally and internationally recognized experts in given topics within infectious diseases, and it's a great way for fellows to meet these experts over the course of their clinical year and have multiple conversations with them about topics related to their areas of expertise that arise over the course of the years. I mentioned one of our conferences a few moments ago, and so we'll just take a moment to walk through some of the core conferences that our program offers on a weekly basis, just to give you a sense for the overall educational experience that the fellows engage in each week here. So on Monday morning, the transplant faculty gather weekly to talk about the patients that they're caring for on the Tucker service at that time, and swap notes, solicit different inputs and opinions about the potential management of complex patients and so on. The fellow who is rotating on the Tucker service joins that meeting every time they're on service to participate in the discussion regarding the care of these patients and help expand their knowledge and understanding of patients who have complex infections in the context of transplantation or other oncology-related immunosuppression. On Monday at noon is one of our core conferences for the fellowship. That's our weekly core didactic conference. Over the summer, as you'll see on the top right-hand side of the table, it's complemented by a summer core curriculum where over the course of the summer on Mondays at noon and Fridays at 8 in the morning, we have sessions that help introduce fellows to foundational ID-related topics. So for example, we start with an introduction to antibiotics led by Dr. Sarah Cosgrove, whom I mentioned at the beginning of the presentation. But also we have talks on, antibiotic allergies and endocarditis, and an introduction to transplant ID-related infections, fungal infections, fever and neutropenia, urinary tract infections, hardware-associated bone and joint infections, pneumonia, and so on. Sort of the fundamental topics are covered during our summer core curriculum. That ends in early September, and then we transition to the remainder of our Monday noon conference curriculum for the remainder of the year, where we have faculty come and speak about, again, foundational topics within infectious diseases. We have roughly an 18-month curriculum so that it repeats twice, or each fellow will see the curriculum 2 times. For those fellows who complete 3 years of training with us, it's an opportunity to hear all the topics at least once. All the sessions are recorded and available to fellows, and then we go through it a second time over the course of the 3 years of training. Included within our Monday noon curriculum is our monthly Fellows Journal Club, as well as the Fellows research presentations that they give at the end of the academic year in May and June, where our 2nd and 3rd year fellows share with the division the research work that they've been up to over the course of their fellowship training. On one more note I'll make about Monday noon is that it's a conference that we protect just for the fellows. So Dr. Krishnan and I attend Monday noon conference each week, and then of course the invited speaker. But otherwise, it's a conference where we only have the fellows present, and it's a way to help build community among the fellows, and also with the faculty speaker who comes to talk that week, and also ensure that there's a safe space that we create for fellows to be able to ask questions freely of the expert without a bunch of other people being present or asking more, sort of finer point or nuanced questions. Bread and butter questions are welcome at these conferences, as well as nuanced questions, of course. But we want to make sure that we have space for fellows to be able to ask whatever questions they wish, and I think we've done that really nicely in the context of our Monday noon conference. On Tuesday mornings is another of our foundational conferences for the program. That's our weekly ID Grand Rounds conference, and so this is a conference led by our fellows, where 2 fellows each week come with prepared presentations about a patient with a known diagnosis. So the fellow will go through, if you will, a standard presentation from the beginning of the history of the present illness through physical examination, laboratory data, and then the results of imaging studies and any other relevant information. And then we'll pause there. Our clinical director, Dr. Paul Atwater, will then call on a faculty member from the audience to discuss the case and generate a differential diagnosis. And then if the answer is named by the faculty member, then the audience votes on what they think is the most likely diagnosis, and the fellow then shares a few didactic slides about the topic and that were of particular interest to them. We've had this conference for many, many years, and it is a great place for the division to come together each week and hear about some of the remarkable cases that we see on service here at the institution. Over the course of fellowship training, fellows will complete somewhere between 10 and 12 of these presentations, with 8 being done during the first year, 2 during second year, and 2 for fellows who stay for a 3rd year of fellowship training. On Tuesday afternoons, every other week, there's a clinical research forum that fellows are not required to attend but are welcome to attend, with lunch provided. We also have lunch at our Monday noon conference. I should have mentioned that earlier. So a clinical research forum every other week throughout the year, where faculty experts from across the university come to share work in which they're engaged. And then we also have a a quarterly antimicrobial stewardship program meeting on Tuesday afternoons, which is complemented by a monthly hospital epidemiology and infection control meeting on Thursday afternoons at noon, which fellows attend a few times over the course of the year, their clinical year, to at least be introduced to the workings of those two committees. We generally don't have core teaching conferences on Wednesdays because our first year fellows have clinic on Wednesday mornings. On Thursday afternoon, we have the third of our three really core divisional conferences each week, which is our clinical management conference. So this is a conference where fellows and faculty get together in person and on Zoom, so a hybrid meeting where folks bring questions from the care of patients for whom they're actively caring, usually inpatients, but also outpatients as well. And they might have either a diagnostic or a management question, and they present the case, and then fellows and faculty share their thoughts about either further diagnostic evaluation or possible management considerations for these patients. We look forward to talking with you about it. It's a very dynamic and active conference with a lot of participation from both fellows and faculty, and a really great place to swap ideas and solicit input from other experts about the management of challenging situations. On Friday mornings, I mentioned our summer core curriculum, which ends in the beginning of September when our weekly departmental medical grand rounds begin. And then on Friday afternoons, we have a few meetings. Once a month, Dr. Christian and I get together with the fellows just to hear about how things are going, ask if there's any problems or challenges that have arisen of which we're not yet aware that warrant discussion and troubleshooting. To gather that kind of input from fellows. And then we also, at 1 o'clock on Fridays, we have our weekly microbiology rounds. The micro rounds have undergone a variety of iterations over time, but we've landed on one here that I think has worked well for everyone involved. So all the attendings and fellows on both the MAN services and the Tucker services, which are based at the Johns Hopkins Hospital, are expected to go to micro rounds on Fridays at 1 o'clock. Our microbiology colleagues, the fellows and the faculty, prepare cases in advance. So they have plates for us to review, and they have some didactic points from a microbiology perspective about the organisms that the faculty and fellows wish to discuss. The faculty and fellows present some of the clinical details about each case, and so it's a very dynamic and vibrant conversation with our microbiology colleagues to the mutual benefit of all parties. And then I mentioned earlier that we have a longitudinal HIV curriculum that Dr. Scully leads for our fellows, and that takes place on Friday afternoons as well. So a range of Friday afternoon meetings. The meetings with the fellows that Dr. Christian and I help to convene, that's a once a month meeting and is a great opportunity for everybody to come together. We share information about announcements and other upcoming events to make sure that everyone is aware of important both meetings and opportunities that are forthcoming, as well as solicit input from fellows about anything that needs to be remedied within the program. And then again, the micro rounds, and which is weekly, and the HIV curriculum, which is every 2 or 3 weeks over the course of the year. Okay, so pivoting from our weekly conferences to the research experience, and I'll make just some general comments here, and would again look forward to talking with everyone during your interview day. I would say a few comments about the research experience is that really there's almost an unlimited array of possibilities from a research perspective here at the institution. I mentioned earlier that we have more than 90 faculty within our division, and the expertise is really broad. We encourage you and welcome you to visit our website to review our roster of faculty, to see the really incredible array of domains in which our faculty are engaged in research. I hesitate to start naming topics here because I don't want to leave any out, but it's an incredible array of opportunities. And so among, that is a daunting number of folks to try to sift through 90 faculty and their interests and whether they may align with yours. And so we have developed scaffolding over time that we think really provides a great mechanism to help ensure that we help you find mentors who will best fit your needs and interests. So we actually have a brief meeting even before you arrive in Baltimore, where we try to get a sense. When I say we, I mean Sonia Krishnan and I, and Sarah Cosgrove and Joel Blankson. The four of us meet with each incoming fellow one-on-one, just to try to get a sense for possible career and research interests. And based upon that initial conversation, Laura Diven, our program administrator, she will schedule meetings with different faculty who work within your area or areas of interest during your orientation time in early July. So we set aside some protected time during orientation before you start on the clinical services in typically mid-July. We set aside time for you to meet with faculty to just talk about the work that they do and see whether there may be mutual interest in continuing to work together moving forward. Those are just introductory, preliminary meetings to help you explore the research community here at Hopkins. And so you have a variety of those meetings over the July, and then maybe over the first few months of the year. We get together again usually the beginning of November, to talk about how those meetings went, and then help provide some guidance and thoughts about the first meeting of the second main bullet on this slide, the first meeting of the Research Guidance Committee that will convene in roughly December of your first fellowship year. So the Research Guidance Committee plays a very similar role to what Drs. Krishnan, Cosgrove, Blankson, and I play in terms of providing initial thoughts about faculty members who are engaging in research in your areas of interest. But it's an even more robust group of faculty. It's approximately 15 faculty with a huge array of expertise, both at the institution, nationally and internationally, spanning all sorts of kinds of research. So you have basic laboratory scientists, translational science, clinically oriented research, and then a range of different domains of infectious diseases. So tuberculosis, viral hepatitis, HIV, transplant oncology related ID, antimicrobial stewardship, medical education, bacterial pathogenesis, and so on and so on. It's a remarkable group of folks that gets together a couple of times a year, to meet with each fellow individually for 30 minutes to talk about their research ideas and progress. The focus of the meetings varies for fellows depending upon the time that they're in their training. But the guidance is really there to help provide additional thoughts and input and suggestions to help make sure that fellows are on track and that they're on a path that's going to lead them to success and to where they want to go and get to after they finish their fellowship training. So that first meeting of the Research Guidance Committee, and we will talk more about this, or would love to talk more about this during your visit, but that committee meets for the first time in December of your first year. Then after that, in January or February of your first year, you'll have a week of research planning time. That's a week where you'll have your half-day continuity clinic, but no other obligations during that week other than to set meetings with faculty to, again, continue to explore and begin to really firm up research ideas, such that hopefully by the early spring, fellows have identified either a primary mentor and or co-mentors or a mentorship team with whom they will work as they begin their second year of fellowship training and start to immerse themselves more intensively within their research projects and ideas. So as noted on the slide, there's no expectation that you would know now or on your interview day or in advance of starting what kind of research you want to do or with whom you would like to work. We have a lot of scaffolding that we've put in place over time to help guide you down that path and help you partner with folks that are going to help you get to where you want to go as you continue on in your career in infectious diseases. So I mentioned there, we have more than 90 faculty within the division, so we have a huge array of potential mentors within our division, and we do almost always encourage fellows to have, if not a primary mentor within the division, that at least a co-mentor. within the ID division, but there are also many other faculty members that are potential mentors for our fellows, including within other divisions or departments within the School of Medicine. And then right across the street from the Johns Hopkins Hospital is the Johns Hopkins Bloomberg School of Public Health, with an incredible faculty there as well, many of whom have helped to mentor or co-mentor our fellows over time. And so for those with relevant interests, again, we look forward to talking more about those possibilities during your visit, your virtual visit. And then just in terms of support for fellows, this, the current academic medicine climate, as everyone knows, is quite dynamic. And so as I record this video in early August, it's very possible that we'll have more information or new information by the time that you interview in September or October. So at this point, I'll just say there's multiple options for support during fellowship year 2, and then for fellows who go on to a third year of training during fellowship year 3, which have included a T32 grant from the NIH that helps to support our program, as well as other fellowship programs within the institution, particularly clinical pharmacology, which is a program through which some of our fellows in the past have pursued joint training between clinical pharmacology and infectious diseases. So there are T32s. There are funding which fellows have sometimes applied for during fellowship year 1 or 2 that they've been able to put towards their support during fellowship year 2 and or 3. And then there's philanthropic contributions that we have been fortunate to receive within our division that can help potentially support fellows during their training. And happy to and look forward to talking with you more about potential sources of support during your interview day. In terms of additional training that's available, so there's everything that I've talked about so far. And then in terms of clinical research skills building, one of the places, or the main place, that fellows have gone to engage in clinical research skills building is what's called the GTPCI, the Graduate Training Program in Clinical Investigation, offered through the Johns Hopkins Clinical Research Scholars Program. This is a degree granting program where fellows learn, again, the fundamentals of clinical research, starting with epidemiology and biostatistics, and then many additional courses that help ensure that fellows are extremely well equipped to lead clinical research programs and immerse themselves in clinical research activities and success over the course of their fellowship training and beyond. All fellows, in addition, are eligible to receive up to 16 free credits at our School of Public Health, and those can be utilized in different courses, as we can talk about during your virtual recruitment visit. And then there's additional courses that fellows have been able to have funded through different mechanisms over the course of time, whether that's through support from their faculty mentors, through grant funding, or otherwise. But there are many ways in which fellows can engage in additional training. Any course at the School of Public Health can be audited, and so that's one of many mechanisms that fellows have pursued to get the additional training they want and need to be able to do what it is they want to do next. So I'll show here just to give you a sense of some of the work that our current fellows are doing, and then in a few slides there's information about what our recent graduates did during their fellowship training. I'll say that we take 4 fellows per year, and so as such we often have 4 second-year fellows and 4 third-year fellows. You only see 6 folks listed on this slide because we currently have 2 fellows who are taking a year to serve as chief residents or assistant chiefs of service, or ACSs, here at the Johns Hopkins Hospital, and so a smaller complement than usual on this slide for that reason. So with that caveat, we have Dr. Emily Hoff, one of our third-year fellows, is working with Schoen Falade Nulia, and Emily, as you can see on the slide, is interested in investigating the impact of social determinants of health on the PrEP cascade for HIV among people who use drugs, and she is has been actively engaged in that work and has achieved great success within it, as I will highlight for all the other fellows here on the slide. Dr. Ruth Howe, also one of our third-year fellows on the ABIM research pathway, is working with Gyanu Lamachane. Ruth has investigated the pathogenesis of Mycobacterium abscessus infections as a way of helping to further explore her interests in bacteriophages and novel drug delivery mechanisms. And I know she, like Emily, would be excited to talk with you about the research in which she has engaged here and will continue to engage over the course of her training. Dr. Zach Lorenz, one of our now second-year fellows, is being mentored by Khalil Ghanem. Khalil is a world's expert in syphilis, and Zach is partnering with Khalil on work looking at the incidence of neurosyphilis among people with HIV, including people who previously were treated for syphilis and whether they may have had and continue to have neurosyphilis following prior syphilis treatment. So exciting opportunity for exploration and learning within that space for Dr. Lorenz. Dr. Anjali Narayanan is working with Ashwin Balagopal on T-cell responses in hepatitis B virus infection. Anjali is building on her prior PhD training to return to the laboratory after having completed her first year of training. She's a second-year fellow, if I didn't mention that from the beginning, and so is excited to immerse herself again in immunology and T-cell responses in particular in conjunction with Ashwin. Dr. Jillian Peters, another of our third-year fellows, is being co-mentored by Drs. Yuka Manabe and Steve Reynolds to explore her interest in emerging pathogens and novel diagnostics, specifically around the topic of spillover infections as a result of animal-human interactions. And then finally, Dr. Seema Sharara is working with Dr. Sarah Cosgrove to further explore her interest in antimicrobial resistance and third-generation cephalosporin resistance to Enterobacterales, specifically around the molecular epidemiology of those pathogens and infections, as well as risk factors for colonization with those organisms. Dr. Sharara is also exploring the effectiveness and success of treatment with cefiderocol as compared with other agents for extensively resistant organisms. And she, like everyone else on the slide here, is really engaging in exciting and dynamic work that I know that all of them would be happy to talk with you about if you were to meet them on your interview day. In terms of where our graduates go after fellowship training, you can see that the majority have pursued careers in academic medicine. That is broadly across many different academic institutions, many of which are research positions, but there have been many others, including within administration or administrative or combination positions, such as, for example, with antimicrobial stewardship program leadership, as well as clinical work. We've had folks go on to take medical education oriented positions within academic medical centers. So a broad range of academic positions that our fellows have moved on to after completing their fellowship training. As you can see, we've also had a range of fellows take on, a number of fellows take on positions in a range of other venues, including fellows who have gone on to governmental work, whether with CDC or other public health departments, a couple who have gone on to positions with industry, and then a number who have gone on to positions within clinical practice. So I think this slide highlights the way in which our program helps to provide a really strong foundation in both clinical medicine and research investigation, positioning fellows to take and pursue employment across a range of different possible job opportunities upon completion of their fellowship training. In terms of just looking at the things from a research perspective in a little bit more detail, and specifically around grant-funded oriented careers over the course of time, the past 20 years now, as you can see on the slide, our fellows have been incredibly successful with K Award applications. You can see over 90% of our fellows have been successful with K Award submissions over the past 2 decades. And the 3 who were not successful with those submissions went on to fantastic positions at academic centers and are thriving in their roles. But I think just this, the success of the fellows in their K Award applications, I think speaks to really the tenacity and the commitment and the ingenuity of our fellows and the incredible work that they do, and then also to the scaffolding and the supports that we provide within our program. I mentioned the Research Guidance Committee and the way in which it takes a village. There's so many faculty here, and all of them are so deeply committed to the careers and the success of our fellows, and that I think is reflected in our K Award success rate over time. We, as I mentioned on the previous slide, fellows, beyond fellows who are interested in research, those who are interested in careers in governmental organizations, CDC, FDA, military, medical research are some examples of that. Other academic positions, I mentioned, folks who have gone on to positions in medical education or clinical practice have been equally successful. And again, excited to talk with you about all of those possibilities during your virtual visit to Baltimore. So I mentioned I would share some information about our recent program graduates, and so this is the past 2 years of graduates from our program. Again, I'll just read over these to give you a little bit of a flavor, a little bit of a sense of the kind of work in which our fellows engage. So Dr. Sean Anderson just graduated from our program in June of 2025, was mentored primarily by Dr. Cindy Sears, and Sean was interested in investigating the biology of C. difficile infection as well as associated mucosal carriage within the gastrointestinal tract and the relationship between those phenomena and the risk of the development of cancer. Sean remains with us here as a clinical and research fellow within the division and is continuing to pursue this line of investigation with Dr. Sears. Dr. Luis Gonzalez Coro graduated in June of 2024. He was primarily mentored by Dr. Greg Lucas, and Luis did fantastic work exploring social determinants of health as barriers to the initiation of hepatitis C virus and HIV treatment, really engaged in really creative community-based, population-based research to explore these interests in more detail. And after finishing his fellowship training, he took a faculty position as an assistant professor at NYU. Dr. Seth Judson just completed his training in June of 2025, was mentored by Dr. David Dowdy, whose primary appointment is in the School of Public Health. And Seth had long-standing interests in zoonoses and understanding the dynamics of them. And so he pursued that interest by exploring work within modeling of yellow fever outbreaks and diagnostics in Ghana during his fellowship training, and built on that work with a successful K Award application, which he is now continuing to undertake that related research as an assistant professor at UCLA. Dr. Derek Hareza graduated in June of 2024, was mentored by Dr. Pranita Tama, pediatric ID faculty member here, and Derek during his time investigated the clinical and molecular epidemiology of extended spectrum beta-lactamase producing enterobacterales infections and was very successful in engaging in that work such that he was able to moved back home to be near family, and is working now as an assistant professor at Northwestern University in Chicago. Dr. Lucy Lee just graduated in June of 2025, primarily mentored by Dr. Nate Perpelong, one of our transplant oncology ID faculty. And Lucy explored the epidemiology and impact of invasive fungal infections, primarily among persons with who had undergone renal transplantation at some point, as a way of beginning to explore her interest in invasive fungal infections more broadly across populations. And Lucy also, like Seth, was the recipient of a K Award, and so she has joined our faculty here at Johns Hopkins as an assistant professor to continue the work in which she began to engage during her fellowship training. Dr. Jawan Sung graduated in June of 2024, also mentored by Dr. David Dowdy from the School of Public Health. And Jawan was interested in pursuing investigations of machine learning and the characteristics of persons who had trace results on, GeneXpert Ultra testing as part of tuberculosis diagnostics. And also, like Seth and Lucy, as I mentioned, was the recipient of K Award funding to support further investigation along these lines, and he has also joined us here as an assistant professor at Johns Hopkins to continue that work. Dr. Caitlin Visek was primarily mentored by Dr. Emily Kendall, and Caitlin studied the outcomes of patients with a trace positive result on Gene Expert Ultra testing, and has prepared a couple of publications related to this work, and she has moved on to an assistant professor position at the University of Pittsburgh Medical Center, building on the success that she experienced here as a fellow. And then finally, Dr. Morgan Walker graduated from our program in June of 2024. She pursued joint fellowship training in conjunction with critical care fellowship training at NIH, where her primary mentor was Dr. Samir Kadri. And Morgan was and remains interested in antibiotic use after the establishment of multi-drug resistant gram-negative bacterial infection guidelines, as well as treatment of crab infections, so carbapenem-resistant Acinetobacter baumannii infections. And Morgan continues to engage in great work within this space as a research associate at the University of Maryland. So I know that is sort of like, that is a lot of information about different people all at one time, but I think the point is just to communicate really just in the 14 people that we've talked about over this slide and the previous one highlighting what our current fellows do, really just the really diverse array of research opportunities that are available to our fellows and all fellows here in our program. And we're so excited to talk with you more about this kind of work when you visit with us for your interview day. So in sum, I would say our program, hopefully I've given you a sense for at least some of this, the way in which we offer truly spectacular clinical training among faculty who are devoted to the clinical training and professional development of our fellows. There are really limitless research opportunities available to our fellows with faculty, not only within our division, but also other divisions, the department, the School of Medicine, the School of Public Health, and so on. A really incredible faculty who are not only world-renowned, but also, as on the bottom bullet on this slide, it's hard to explain this, I know, just through a sort of a virtual presentation like this with slides and talking. And even on the interview day, I think it's hard to fully capture the way in which it really is just an incredibly collaborative, collegial, and mutually supportive environment led by our division director, Dr. Amita Gupta, and her predecessor, Dr. Dave Thomas, who shared with me when I first became involved with the leadership of the fellowship program a long time ago now. You know, he shared with me that his perspective that, you know, the purpose of fellows is not to be the clinical workhorses of the division, but the purpose of fellows is, fellowship training is to develop expertise to be able to go on to become leaders within infectious diseases. And so that has obviously stuck with me for a long time, and that is the ethos that Amita brings to the division and that we continue to bring to the fellowship program to help ensure, put together mentorship and guidance and coaching and advice that helps fellows to be successful and go on to become those future leaders in ID. And we do this through, really fellowship-centered, individualized mentorship that we're excited to talk with you more about. A few sort of administrative details that I think are important to note are our Associate Dean for GME has been successful in lobbying for higher salaries for fellows over time, and we're pleased to share these salaries with you here. So this is for the, that should say the 2025-2026 academic year. Apologies for that. But this is for current first year and second and third year fellows. These are the salaries for the 25-26 academic year. In addition, there are some additional benefits now available to fellows as of this academic year, including, as you can see, a housing stipend, a cell phone stipend, and for fellows who are paid a wage, a 2% 403B contribution over the course of the academic year, in addition to health insurance for fellows and families. So these are the benefits benefits that are available, and again, welcome you talking with our fellows about them, talking with the faculty about any questions you might have about any of this. It's hard, I know, with virtual recruitment to try to get a sense for all of the cities, in which the programs with whom you're interviewing are based, but Baltimore is really a special place. We're happy to talk with you about it in more detail. So my wife is a member of the GI faculty here. She does translational science in inflammatory bowel disease, and when she was finishing her fellowship training, I was a junior faculty member here, and so we had some questions as to whether she was going to try to get a faculty position here and I was going to stay, or whether we might look elsewhere. And it was not a very long conversation because we both knew that we wanted to be here. She had done her residency training here as well and had a lot of fondness for the institution. And we both have been so grateful to be able to be here for our careers to date. It's an incredible place to work and train, and then also a really fantastic place to live and for us raise our family. And so there's many exciting things, some pictured on the slide here, that go on within the city and then the surrounding counties and communities. And we're really excited to talk with you about the vibrant life that exists here in Maryland and the really rich array of outside of hospital opportunities that are available to people here in Baltimore and Maryland. And just a few final photos here. This is our fellowship graduation from this just a couple months ago. You can see the graduating fellows there, Lucy, Sean, Kate, and Seth, with our former program administrator, Shelley Sasser, Sonia, me, and Mita, our division director. Really fantastic day. And then a group of us were together to celebrate the accomplishments of our graduating fellows. Just one of many times that we come together over the course of the year to be with one another in community and learn and grow from one another. So a great opportunity and a great day. So hopefully this has given you some sense for our program. There's even more information available on our website. I put the web address there. There's a range of videos, some of which were put together by our fellows to talk about their experiences in the program, the clinical experiences, the research experiences living here in Baltimore. And then there's many videos from faculty talking about a range of different aspects of our training program, videos from divisional leadership, including Drs. Gupta and Solkowski, the division directors at the Johns Hopkins Hospital and the Bayview Medical Center, respectively, our clinical director, Dr. Paul Atwater, and so on and so on. So there's a lot of information on there. We welcome you to check it all out and look forward again to talking with you more during your visit. And then finally, just for even further information about Baltimore, and again, recognizing that it's hard to not be able to visit the physical place of the programs with which you're interviewing, there's the GME office has a virtual tour of the Johns Hopkins Hospital and the Hopkins Bayview Medical Center available to you to check out, among a range of other videos and information about living in Baltimore and the institution that we welcome you to review. So thanks very much for taking an hour of your day to spend time with me here to hear about our program. Again, hope you've gotten a good sense for things, and we're really excited for your application and look forward to talking with you more when you visit with us by Zoom here very shortly. Have a great day, and thanks so much.